Hi there, this is Anna Dolopo, and today is July 30, 2021, and I want to make another video specifically regarding what to expect in working with me. I did do an accountability video, an expectations video. This is going to be a nice short and sweet video to supplement those other ones, but also to give you clear updates. When you see people's testimonials and it looks fantastic, those are more likely people who came 3 or more times a week. So when I tell people, if you want to be aggressive, come 2 or more times a week, you have to understand that 2 is better than 1. Okay, so if you want to be aggressive, you may really want to consider coming 3 or more times almost daily if necessary for those first 2 to 6 weeks, so you can see fantastic, phenomenal results much more quickly. So that is the message that I really want to convey in this video. So if anything happens to me or anyone that I know that in my family, if there's any physical or mental health issues, especially acute, or if there's something that's been going on, I want to take care of it immediately, treating myself daily or almost daily. Okay, so if you come under once a week, don't expect much. Don't really have any expectations. If you come once a week, then please be super patient. I want to see 30 to 70% improvement at least within those first 2 to 4 months if you're coming once a week. If you're coming 2 or more times, especially if you're coming twice a week, then better than once a week. I want to see 30 to 70% improvement in 2 to 6 weeks, but you will be more aggressive if you're coming 3 or more times a week. And the reason why I'm sharing this is because I received a random text from someone that I had helped achieve a major goal, and she said she really feels that she was the huge difference in coming 3 times a week for the length of time that she was here. And I share this in my other videos, how many times a person came in for sciatic pain, anxiety, other types of health issues, especially fertility. I'm going to read exactly what to expect in regards to fertility in just a moment, but please make it very clear to yourself that if you are new or if you've been with me for a while and you want to see faster results, you will see faster results if you come 3 times a week minimum. Twice a week is great, but if you want to see faster results, then come 3 or more times a week. I want to be very clear. If you're coming in for fertility and your libido is not at least an 8 on a scale of 1 to 10, then I just want you to know that if you've been working with me 20 or more times and your libido is not at least an 8, then you're getting a glorious nap here. We need to make sure you're taking herbs, doing moxibustion at home, doing acupuncture, and you may really want to consider doing acupuncture aggressively 3 or more times a week, or you're here for the long haul. Be very patient. Now, when I tell women the recommendations, it's up to you to decide how many times you want to be here. So if you go under once a week, don't expect this to do very much. If you're going once a week, then that's the pace. If you like where your libido is, if you like how your cycles are going, then come once a week. If you're going 2 or more times a week, we will see faster results. Fertility is more of a marathon, so you have to budget your time, you have to budget your money, but just know that when we're going more aggressively, we're seeing better results. And with fertility, it's pretty much the results as a baby. So again, in the other videos, I talk about 6 to 12 cycles, 12 to 18 cycles, or 2 to 3 years. I'm going to make it very clear for natural, and then I'm going to talk about IVF and IUI. If you have no medical diagnosis, it's 6 to 12 cycles. If you have a medical diagnosis or 1 miscarriage, I ask for 12 to 18 cycles. If you have 2 or more miscarriages or a severe medical diagnosis, I ask for 2 to 3 years. If you have any failed IUI or IVF, I request 2 to 3 years. So please, this is all over my website. This should not be new news to you. when I say symptoms, I'm talking about physical or mental health issues. Between days 1 to 10 in your cycle, if you have 0 mental or physical health symptoms, you're not moody, you don't have any menstrual cramps, you don't have any anxiety or UTI or anything like that, then come in once a week for those first 1 to 10 days of your cycle. If you have any symptoms, come in 2 or more times a week. Obviously, the more aggressive, the better. If you're coming in between day 10 to 20, same thing, come 1 to 5 times a week. Ideally, during your ovulation week, you're coming in more aggressively. If I had it my way, you'd be coming in 3 times a week. Make sure you watch the mental health of men and their emotional issues. Men and their emotional health. Make sure you please understand that, especially the study regarding sperm health. Okay, you should not be going past day 2 in regards to high quality sperm. All right, there are studies, you can find them on the National Institutes of Health, you can find them on the Mayo Clinic. I'm not going to discuss it in this video. Between day 20 to 30, 1 to 5 times a week. If you have PMS symptoms or anything like that, you should be coming in 2 or more times a week. Okay, so I say it right here, and it was sent to you. Come in 1 to 5 times a week, unless depending on your symptoms. Frequently, if you have any symptoms, within 1 to 4 days. For IVF, before your procedure starts, twice a week until transfer for 6 months, or 3 months minimum prior to retrieval. And then that means you're going 3 times a week for 3 months, or twice a week for 6 months. And then after the retrieval, you're coming in 3 times a week prior to transfer. All right, so any fertility client, your husband, your male partner needs to be here 4 times a month. Okay, I don't deviate from that. If you're doing IUI twice a week for 6 months prior to the IUI, or 3 times a week for 3 months. So you got this text, you got this email. This is a short and sweet video to tell you exactly what to expect when we work together. Please watch the expectations video, especially if you're a new client. My specialty is making sure stuff happens correctly. My specialty is making sure things get done here. So you can watch all my other videos. I've done 130 videos, especially regarding pain, 1920 on fertility. It should be spelled out, a lot on accountability, a lot on expectations, and I'm going to share it again here, but I'm going to ask for you to please watch these videos so it seeps in, so it really seeps in and you understand what to expect in working with me, because this is not like, if you're coming in once a week, then expect to be very, very patient. Okay, if you're coming once a week, expect to be very patient, and I want to see 30 to 70% improvement in 2 to 4 months. If your libido is not at least an 8 on a scale 1 to 10, consider coming 2 to 5 times a week for at least a month or more. So, there are so many things that I treat here. I just want to make sure people understand exactly what to expect out of acupuncture, because in most cases, this should have been the medicine you turn to first, not as a last minute resort. And when people are coming in to see an acupuncturist because everything else failed, well, then we're working backwards instead of forward. So I hope this helps. Please watch the other videos so you understand exactly what to expect from working with me. I want to see your goals happen. I want you to achieve your wellness goals here. My website is elementsandharmonyacupuncture.com. If you're watching this video, then you are more than likely already a client here, and I want to make sure that I give you the best service available. All right, take care. Have a great day.